Sjogren syndrome. It is a chronic autoimmune, slowly progressive lymphocytic infiltration. Exocrine gland and other organs is also involved. It is autoimmune disease having two categories, that is organ specific called as Graves disease and systemic involvement called having rheumatoid arthritis. More commonly occurs in female as compared to male. Main genetic predisposition for Sjogren syndrome is HLA-DQ1, and also there is secondary association disease like most commonly rheumatoid arthritis. Second one is SLE. Third one is scleroderma, and fourth one is chronic active hepatitis. Then there is a triad of primary Sjogren syndrome, that is dry eye, dry mouth, and bilateral parotid enlargement. The main pathophysiology behind this is infiltration of tissue by the lymphocyte that comes in early stage, that is called lymphocytic infiltration, and second one is B cells comes in late stage. The diagnostic tool is we see the anti-Rho or anti-La antibody. Now genetic predisposition like HLA-DQ1 trigger is infection. Now how to what are the clinical features for Sjogren syndrome is dry mouth it because of salivary gland has been targeted, the reduced saliva in the mouth, that condition known as xerostomia. Second one is we check for salivary flow. Then second one is dry eye, that is in fact targeted for lacrimal gland that decrease the tear. Dry eye, sand as enter eye, like eyes having symptoms like red, pain, itching. For that we do a shimmer test or rose bengal test. How to do shimmer test? Put dry filter paper in lower eyelid and wait for 5 minutes. In normal person, filter paper wet more than 10 mm, but in Sjogren syndrome, less than 5 mm not wet. So, rose bengal is a inert stain. In normally eye, no stain because eyes are wet, sclera not take the dye, but in dry eye, sclera stain pink. So, some inflammatory arthritis is also happen in this condition. It causes non-erosive arthritis, therefore no joint deformity. Therefore, on X-ray no deformity is seen. In neurological conditions, we see the depression in some patients and peripheral neuropathy also. In lungs, we saw the fibrosis. In kidney, renal tubular acidosis type 1, dry vagina, that is painful coitus, that is also known as dyspareunia, also itching in vagina. Then some skin conditions like dry itching, in GIT, dysphagia, gastritis, also non-Hodgkin lymphoma. These patients of Sjogren syndrome, macrophages release interleukin 18, that is prone to develop the non-Hodgkin lymphoma. And for investigation, we use shimmer test, rose bengal staining test, focus test. Focus test is for lymphocyte infiltration, especially in the minor salivary gland, that destroy the acini, that decrease saliva, and dry mouth is happen. Then we take biopsy from focus, that is more than equal to one focus, that is positive test, also known as positive focus test. Also, we do salivary scintigraphy, that is a radioactive isotope, and check for salivary flow. How to treat? And then we treat symptomatically. For increasing the saliva, we use pilocarpine or cevimeline. For dry eye, we use the cyclosporin or artificial tear. For joint pain, we use NSAIDs, or we use chloroquine or methotrexate for systemic use, and chloroquine and methotrexate also used for joint pain. So that's all about Sjogren syndrome.